Yeah, implants, as we've stated, are transformative. They are, and perhaps in the dental world, we see them and work with them so much, they become a little bit more household in our office, which is a good thing if you're a patient.
Yeah.
You don't want this to be the first experience of an implant, but where it's a little bit more household, we know some of the nuances to implants and how to incorporate technology. In particular, patient coming in that's broken a tooth off, say at the gum line, we've seen that regularly. And one case in particular was a lady, she's in her 50s, and she came in one day, her tooth was broken off right at the gum line. It's just tragic. And although it's something I see regularly, for this patient, this was earth-shattering. If you can imagine, everybody's had that dream where you wake up and you have no teeth. For whatever reason, in our psyche, we do not like the idea of not having teeth.
Yeah.
This was this lady's reality. And so she came in, and we, after the initial evaluation and taking some high-tech imaging of this area, we were able to tell her and put her mind at ease, hey, you're a good candidate for implants. And in this case, it was just a single implant. So she was relieved, because the last thing you want to do is go to work with a big gap.
Right.
You can only wear a mask for so long. They're only so comfortable. And so we were able to help her same day. And we took the remaining tooth structure out. But what people sometimes don't realize is, as you break a tooth, that's just the top portion. That's just this portion. There's a part of the tooth structure under the gum line, and that's the root tip. If that's not removed, you can incite a little bit of infection, certainly some discomfort. And so we took that remaining tooth structure out, that root tip, and we were able to place an implant on that exact same day. And this is a replica of a back tooth, but similarly, we would use these two parts here. We placed this titanium piece, following which we put an abutment in, and then we were able to create a tooth in that space. And she walked out of here with a tooth. And so for her, having that harrowing experience of losing something that was hers, very much a part of her body, she was able to come here and get some relief psychologically, which I would argue sometimes the more concerning piece, right? Yeah, we can do the dentistry, we can do things to fix you up, but it's that psychological piece that is a challenge. And so when she left, she was just all but in tears, and she was just so grateful. And again, that's why some of the love for this type of dentistry is there for me, is it means so much to people. And where are they going to go if they can't get their tooth fixed? They've got to come to a place like Canyon Dental that can help them really get past this hard challenge. And that was one case for me that I'll never forget. We've seen quite a few of those, and sometimes it's a back tooth that isn't as visible, and so not maybe as stressful for a patient, but still losing a tooth is very, very challenging. And we're there to kind of empathize with that patient, get them through that challenging time. That's kind of fun for us. So.
Yeah.